greatest risk factor for the development of cancer? Is it age, alcohol use, cigarette smoking, female sex, or obesity? The answer is age. Although cigarette smoking is the greatest modifiable risk factor for the development of cancer, the most significant risk factor for cancer in general is age. 2/3 of all cancers are diagnosed in individuals older than 65 years, and the risk of developing cancer between the ages of 60 and 79 years is 1 in 3 in men and 1 in 5 in women. In contrast, the risk of cancer between birth and age 49 years is 1 in 70 for boys and men and 1 in 48 for girls and women. Overall, men have a slightly greater risk of developing cancer than women, with a 44% versus 38% lifetime risk. Among women younger than 60 years of age who die from cancer, which of the following is the most common primary organ of origin? Is it breast, cervix, colon, bone marrow, or lung? The answer is breast cancer. The cause of cancer death differs across the lifespan. In women who are younger than 20 years of age, the largest cause of cancer death is leukemia. Between the ages of 20 and 59 years, breast cancer becomes the leading cause of cancer death. However, lung cancer is the leading cause of cancer death after the age of 60 years and is overall the #1 cause of cancer death in women. What is the most common side effect of chemotherapy? Is it A, alopecia, B, diarrhea, C, febrile neutropenia, D, mucositis, or E, nausea with or without vomiting? The answer is E, nausea with or without vomiting. Nausea with or without vomiting is the most common side effect of chemotherapy. It can be anticipatory in nature, acute, or occur more than 24 hours after administration. Patients at increased risk of nausea include younger patients, women, and those with a history of motion or morning sickness. A primary tumor of which of these organs is the least likely to metastasize to bone? Is it A, breast, B, colon, C, kidney, D, lung, or E, prostate? The answer is B, colon. Metastatic tumors of bone are more common than primary bone tumors. Prostate, breast, and lung primaries account for 80% of all bone metastases. Tumors from the kidney, bladder, and thyroid, as well as lymphomas and sarcomas, also commonly metastasize to bone. Metastases usually spread hematogenously. In decreasing order, the most common sites of bone metastases include the vertebrae, proximal femur, pelvis, ribs, sternum, proximal humerus, and skull. Pain is the most common symptom. Hypercalcemia may occur with bone destruction. Lesions may be osteolytic, osteoblastic, or both. Osteoblastic lesions are associated with a higher level of alkaline phosphatase. Colon cancer typically metastasizes initially via lymphatic spread, making the liver and lungs common sites of secondary disease. A 55-year-old man is found to have a serum calcium of 13.0 milligrams per deciliter after coming to clinic complaining of fatigue and thirst for the past month. A chest radiograph demonstrates a 4-centimeter mass in the right lower lobe. Which of the following serum tests is most likely to reveal the cause of his hypercalcemia? A. Adrenocorticotropic hormone, ACEH, B. Antidiuretic hormone, ADH, C. Insulin-like growth factor, D. Parathyroid hormone, PTH, or E. Parathyroid hormone-related protein, PTHRP. The answer is E. A variety of hormones are produced ectopically by tumors that may cause symptomatic disease. Eutopic production of parathyroid hormone, PTH, by the parathyroid gland, is the most common cause of hypercalcemia. Hypercalcemia may rarely be produced by ectopic hyperparathyroid production but is most often caused by parathyroid hormone-related protein, PTHRP production by squamous cell, head and neck, lung, skin tumors, breast tumors, genitourinary tumors, gastrointestinal tumors. This protein can be measured as a serum assay. Antidiuretic hormone, ADH, causing hyponatremia, is commonly produced by lung, squamous small cell tumors, gastrointestinal tumors, genitourinary tumors, ovary tumors. Adrenocorticotropic hormone, ACTH, causing Cushing's syndrome, is commonly produced by tumors in the lung, small cell, bronchial carcinoid, adenocarcinoma, squamous, thymus tumors, pancreatic islet tumors, medullary thyroid carcinoma, insulin-like growth factor secreted by mesenchymal tumors, sarcomas, adrenal tumors, hepatic tumors, gastrointestinal tumors, kidney tumors, prostate tumors may cause symptomatic hypoglycemia. A 29-year-old man is found on routine chest radiography for life insurance to have left hilar adenopathy. CT scanning confirms enlarged left hilar and para-aortic nodes. He is otherwise healthy. Besides biopsy of the lymph nodes, which of the following is indicated? A. Angiotensin-converting enzyme, ACE level. B. Beta-HCG. C. Thyroid-stimulating hormone, TSH. D. Prostate-specific antigen, EC reactive protein. The answer is B. Beta-HCG. Explanation. The patient is a young man with asymmetric hilar adenopathy. The differential diagnosis would include lymphoma, testicular cancer, and less likely tuberculosis or histoplasmosis. Because of his young age, testicular examination and ultrasonography would be indicated, as would measurement of A-fetoprotein, AFP, or beta-human chorionic gonadotropin, BHCG, which are generally markedly elevated. In men with carcinoma of unknown primary source, alpha-fetoprotein and beta-HCG should be checked because the presence of testicular cancer portends an improved prognosis compared with possible primary sources. Biopsy would show lymphoma. The ACE level may be elevated but is not diagnostic of sarcoidosis. Sarcoidosis should not be considered likely in the presence of asymmetric hilar adenopathy. Thyroid disorders are not likely to present with unilateral hilar adenopathy. Finally, prostate-specific antigen is not indicated in this age category, and C-reactive protein would not differentiate any of the disorders mentioned above. Biopsy is clearly the most important diagnostic procedure. A 73-year-old man presents to the clinic with 3 months of increasing back pain. He localizes the pain to the lumbar spine and states that the pain is worst at night while he is lying in bed. It is improved during the day with mobilization. Past history is notable only for hypertension and remote cigarette smoking. Physical examination is normal. Laboratory studies are notable for an elevated alkaline phosphatase. A lumbar radiogram shows a lytic lesion in the L3 vertebra. Which of the following malignancies is most likely? A. Gastric carcinoma. B. Non-small cell lung cancer. C. Osteosarcoma. D. Pancreatic carcinoma. E. Thyroid carcinoma. The answer is B. Non-small cell lung cancer. Explanation. Bone pain resulting from metastatic lesions may be difficult to distinguish from degenerative disease, osteoporosis, or disc disease in elderly individuals. Generally, these patients present with insidious worsening localized pain without fevers or signs of infection. In contrast to pain related to disc disease, the pain of metastatic disease is worse when the patient is lying down or at night. Neurologic symptoms related to metastatic disease constitute an emergency. Lung, breast, and prostate cancers account for approximately 80% of bone metastases. Thyroid carcinoma, renal cell carcinoma, lymphoma, and bladder carcinoma may also metastasize to bone. Metastatic lesions may be lytic or blastic. Most cancers cause a combination of both, although prostate cancer is predominantly blastic. Either lesion may cause hypercalcemia, although lytic lesions more commonly do this. Lytic lesions are best detected with plain radiography. Blastic lesions are prominent on radionuclide bone scans. Treatment and prognosis depend on the underlying malignancy. Bisphosphonates may reduce hypercalcemia, relieve pain, and limit bone resorption. A 52-year-old woman has been having worsening cough for the past month. She is a non-smoker and has no known health problems. The cough is non-productive and present throughout the day and night. It worsens when lying on her back. She has also noticed some upper chest pain and dyspnea on exertion for the past week. A chest radiograph shows a large mass, greater than 5 centimeters, confined to the anterior mediastinum. Which of the following diagnoses is most likely? A. Hodgkin's lymphoma. B. Non-Hodgkin's lymphoma. C. Teratoma. D. Thymoma. E. Thyroid carcinoma. The answer is D. Thymoma. Explanation. Thymoma is the most common cause of an anterior mediastinal mass in adults, accounting for about 40% of all mediastinal masses. The other major causes of anterior mediastinal masses are lymphomas, germ cell tumors, and substernal thyroid tumors. Which of the following tumor characteristics confers a poor prognosis in patients with breast cancer? Is it A. Estrogen receptor positive, B. Good nuclear grade, C. Low proportion of cells in S phase, D. Overexpression of ERBB2, also known as HER2-NEU, or E. Progesterone receptor positive? The answer is D, overexpression of ERBB2, also known as HER2-neu. Pathologic staging remains the most important determinant of overall prognosis. Other prognostic factors have an impact on survival and the choice of therapy. Tumors that lack estrogen or progesterone receptors are more likely to recur. The presence of estrogen receptors, particularly in postmenopausal women, is also an important factor in determining adjuvant chemotherapy. Which of the following tumor markers is appropriately matched with the cell type cancer and can be followed during treatment as an adjunct to assess disease burden? Is it A, California, 125 for colon cancer, B, calcitonin for follicular carcinoma of the thyroid, C, CD30 for hairy cell leukemia, D, human chorionic gonadotropin for gestational trophoblastic disease, or E, neuron-specific enolase for non-small cell carcinoma? The answer is D, human chorionic gonadotropin for gestational trophoblastic disease. Tumor markers are proteins produced by tumor cells that can be measured in the serum or urine. These markers are neither sensitive nor specific enough to be useful for diagnosis or screening of cancer. However, in an individual with a known malignancy, rising or falling levels may be helpful for determining disease activity and response to therapy. Of the tumor pairs listed, only human chorionic gonadotropin is correctly paired with its association with gestational trophoblastic disease. Thanks for watching. Subscribe, like, and share for more questions and explanations based on international clinical textbooks.